Hello everyone, my name is Pooja and I've done my master's in medical microbiology, and from the past 1.5 years I've been associated with MyAussieTutor and providing online academic services. So today we'll be discussing a very interesting topic, which is effectiveness of scheme therapy for borderline personality disorder. So what are the learning outcomes of this presentation? Firstly, we'll be able to enhance the knowledge of nursing professionals by focusing the shift of their care towards mental health needs of people experiencing borderline personality disorder. So, followed by to introduce this concept of brief scheme group therapy in support of borderline personality disorder. Then increase the use of therapy in clinical settings by enhanced awareness and also by ensuring the long-term engagement of the patients with the therapy and the role of time and management of the patients with the help of scheme therapy. So, as we know that borderline personality disorder, also known as BPD, is a common and severe mental health illness. In Australia, around 6.5% of people are living with borderline personality disorder. So this ratio is this percentage is very significant and is increasing day by day. So therefore there is a need to design effective interventions or therapies for ensuring the safety and well-being of the patients experiencing borderline personality disorder. Scheme therapy was developed to help people suffering with personality disorders and various other mental disabilities. This scheme therapy is an alternative approach to support the mental health needs of the patient experiencing borderline personality disorder. It incorporates ideas and approaches from different therapies, including cognitive behavioural therapy, family systems, group therapy, and psychoanalytic views. So these all are the resources which are being combined to design a specific intervention which is known as scheme therapy and can support the mental health needs of the patients suffering with BPD. So moving to the next slide, we'll discuss about mental health needs of the patients. It can be categorized into three major needs, which are the basic needs, psychological needs, and self-fulfillment needs. The basic needs will include safety needs and the psychological needs. The psychological needs can be explained in terms of food, water, rest, and everyday resources. The psychological needs like esteem needs, like prestige and feeling of accomplishment. So this is also a very important need, but is more often neglected by most of the individuals, which thereby leads to personality disorder. And the last one is the self-fulfillment needs, which includes self-actualization, including achieving one's full potential, including creative activities. So this self-fulfillment needs is a very common need that or we can say approach that is utilized by most of the healthcare professionals while engaging their scheme therapy for ensuring their safety and well-being. So various needs are, so every individual have different needs and set of self-fulfillment needs which must first be identified by the healthcare professional or the therapist, and then a care plan must be designed in order to upgrade their mental health. So these all were the this all is based on the mental health needs. So in this slide we'll discuss about scheme therapy in particular. Scheme therapy is also known as ST. It emphasizes the therapist and patient relationship and its potential for corrective influence. ST aims to develop patients understand their core emotional needs and to learn ways of meeting those needs adaptively. The therapy increases the emotional balance, increase self-confidence, increase cognitive flexibility as well. It also based on enhanced trust, better self-understanding, lower self-blame, and better self. These all will be related for ensuring a safe environment and safe behavior among patients who are experiencing borderline personality disorder. So this scheme therapy will majorly focus on the feelings and thoughts of a person, because the person who has been diagnosed with BPD will display a behavior challenge and negative thoughts. So these all thoughts and feelings will define the behavior of a person. A normal person will reflect a normal behavior, but a person experiencing BPD will reflect a negative behavior or a challenging behavior, which will eventually lead to social isolation and increase the health burden of the affected individual. So this scheme therapy will majorly focus on feelings and thoughts and try to improve them in a positive mode and thereby improve the overall behavior of the individual. So behavior change model, because we can say that this scheme therapy works on a behavior change model instead of providing any external resources. The patient behavior is dependent on individual factors like capability, motivation, and opportunity. The healthcare professionals can include the protection motivation theory. Motivation can change lifestyle patterns, intrapersonal skills including communication. So this communication is the first targeted area among the individuals who are affected with BPD, and therefore improving communication is very essential because it will help the patient to increase social engagement, thereby lowering mental health burden. It will also ensure that the patient is able to communicate and interact better with the healthcare professional, thereby also increasing their overall health and well-being. So this therapy will basically focus on improving the behavior of a person. That's why it is also termed as behavior change model. So it will work on what are all the threats that an individual is facing, because a person can feel low and lack of self-confidence. So these all can be the threats of a person as well as vulnerabilities. So these will be identified and behavior change model or this scheme therapy will be applied for improving and by providing the coping appraisal and response efficacy in order to improve the self-efficacy among the individuals. In this way, the behavior intentions will be enhanced and at last adaptive behaviors will be gained by the individual who are being experiencing borderline personality disorder. Because at this point, at the borderline point, there is a need to provide the effective and correct intervention so that the person will not totally shift toward the personality disorder zone. So at this point, the healthcare professionals must be able to understand the needs and preferences of the patient and thereby design effective care model for ensuring their safety and well-being. So what are the domains of scheme that can be engaged in scheme therapy? The domain 1 is disconnection and rejection. There are basically 5 major domains which will be discussed in this presentation. The first is disconnection and rejection. The second is impaired autonomy and performance. The third is impaired limits. Fourth is other directedness, and the fifth is over negligence and inhibition. The domain 1 based on disconnection and rejection includes schemes that make it difficult to develop healthy relationships with others. So this is a kind of threat that can be identified by the healthcare professional in order to approach it in a better way. The second domain based on impaired autonomy and performance will include schemes that make it difficult to develop a strong sense of self and function in the world as an adult. So it can also be approached by the healthcare professional in a better and timely way. The third one, based on impaired limits, includes schemes that affect self-control and the ability to respect boundaries and limits, wherein the person will not be able to communicate in a better way and will not interact within the boundaries and limits and will behave in an inappropriate manner. So these all factors will also be approached by the healthcare professional. The domain 4, other directedness, includes schemes that lead you to prioritize the needs of others above your own in case it is required. The fifth one, over negligence and inhibition, includes schemes that prioritize avoiding failure of mistakes through alertness, rules, and disregarding desires or emotions. So the fifth one is very essential because in case the person is not alert and will start to disregard their personal desires and emotions, will transform them totally into a personality disorder phase, which will be difficult to treat. Thereby, understanding all these domains or schemes is very important so that effective therapy will be arranged by only after understanding these particular domains of the schemes. In this way, effective and patient-centered care can be designed by engaging the scheme therapy for the better health and well-being of the patient. So moving to the next slide, we'll discuss what are the benefits after we will impose or we will engage this scheme therapy. The scheme therapy increased comprehension of self and self-management as per 86% points of the participants. This has been proven by a study. It will also help to achieve one's personal goal as well as decrease in self-harm, because at last the person with a negative attitude and behavior and disregard towards oneself will eventually lead a person towards self-harm or suicide. So this is a condition that needs to be fixed as soon it is required. Thereby providing this scheme therapy will ensure and decrease the scope of self-harm among the patients. The patients will receive system coping techniques for ensuring their safety and well-being. So moving to our next slide, we'll discuss what all are the limitations of this therapy. If we will compare this therapy with the other therapies, scheme therapy can be a long-term commitment, because firstly, because if a healthcare professional is going to transform or shift a behavior of an individual, especially those experiencing borderline personality disorder, the shift of their behavior is a very long-term process and not a one-day process. So it will ensure or include a long-term engagement of the patients, and thereby one may need to undergo scheme therapy for years. This long-term engagement is not ensured by any individual or the patient, and thereby limit the scope of this scheme therapy for improving the conditions among borderline personality disorder patients. Secondly, there is a lack of awareness among nursing professionals regarding brief scheme therapy, because most of the professionals or the nursing professionals will lack this education about the advanced scheme therapies and how it can play a very significant role in improving the borderline personality disorder. And the third one is lack of psychologists to understand the needs and importance of scheme domains, because scheme domain and identifying various domains is also essential part, because these will form the basis of further care or the therapy intervention, where the psychologists who lack this capacity to identify the scheme domains will not be able to ensure or lead the scheme therapy in a right path for improving the overall health and safety of the patients. So to summarize, we can say that the borderline personality disorder is a psychological disorder which can be managed with the help of effective scheme therapy. This therapy proposes the introduction of therapeutic treatment for understanding patient needs and preferences, thereby suggesting more easy and supporting ways for patient safety. The patient can be encouraged by motivating and encouraging them for a healthy behavior. It will eventually increase adaptive, resilient, positive behavior among the patients. So we can say that the borderline personality disorder is a complex psychological disorder where care should be taken by identifying all the care and needs of the patients. In this presentation, the students will gain a better understanding about the BPD and how the nursing professionals or the therapist will engage critical thinking skills and communication to better engage with the patient population, and thereby understanding their needs and scheme domains for ensuring a patient-centered care plan for their safety and well-being. It will also make sure that more information will be gained by the healthcare professionals as well as a psychologist in order to improve their knowledge about identifying the various scheme domains for ensuring the safety and effective provision of scheme therapy for improving the condition of patients who are experiencing borderline personality disorder in order to improve their overall health and well-being. So these are all of the references to design this presentation. Thank you and have a nice day.